Do you see how much higher this is here? How much tighter? From here to here is a huge knot. This is much lower. Let this side go. There it is. Yeah. That bone has not moved in a while. When my butt comes off the chair, I'm working way too hard.
Feels so good.
Split there, babe.
Severe neck, shoulder pain?
Yeah, so it's way better now, but at the time I made the appointment,
Yeah.
I could not move to the right.
Turn your neck at all.
Yeah, and I see what you do for the people with
Yeah.
the massage. Because the regular chiropractors join chiropractic and stuff. They only do the adjustments. They don't do the massage. So
And even-
I see the spots you're hitting, and that's exactly where.
It's
I'm
hard
feeling
to,
the pain.
as a patient, it might be hard to tell where they adjust to. You know, the lower neck is so commonly the most injured area. And so if the joints, for instance, on this side are swollen, you won't be able to compress them, right? And so this part of the neck isn't where we should be utilizing very much anyway. We should be using our upper neck to do most of the work. But if the lower neck is doing all the work, so it's your backup engine doing the work, the
Right.
upper neck is your main engine, it doesn't work. So now you're not left with anybody to actually function with. And so you can't turn your neck at all without, was it just going in the neck or was it going down
It was going
into the shoulder?
It was going downwards into the shoulder too.
So when that happens, we're involving two things. You have the joint in the lower neck that's sprained, so the actual knuckle back here is injured, and then the wire coming out from the side will radiate pain over into the shoulder. So you have the nerve in the lower neck involved and the joint. So there's really two injuries, but it can be a disc injury, but the local pain is most likely the joint that was given. That's why you couldn't turn your neck. The joint is swollen, but usually if the joint's injured, most likely the disc is injured also. The care chiropractically should be focused on exclusively the areas around that aren't injured that take the stress off the injured area.
Okay. And my wife tells me like all of this is really hard.
Yeah.
It's really, really hard.
The muscles will get tight.
Yeah, very, very tight.
To protect. Yeah.
Yeah.
So if you turn your neck to the right, go ahead and, any pain right now when you turn right?
Just a little bit.
A little bit on the right.
Yeah, on the right.
Okay, and then turn your head left for me. Even that way is a little more restricted than the right. Okay. More straightforward. I got you. All right. Left shoulder's a little elevated, so that's avoidance of that right side. So when I'm looking at you, you're still in avoidance. So like when these joints get injured, your body will just sort of, heal tilted away from it. Now what'll end up happening is if you stay in this kind of alignment for too long, the other side will start to get injured because we're throwing the weight away from the right side and onto the left. Any pain in your lower back, anything else?
Yes, prior to this, I had the tightness,
Okay.
the lumbar. I had that. It was really, really bad.
Right in the small of your back down here?
Yeah, it was more on the right side though.
Okay.
Yeah.
And if you tilt your body to the right or tilt left, does it hurt?
Right now, no.
Nothing. But do you think in the past it has hurt?
Just it's really bad. It
just
was
moving
tight.
around.
Yeah.
All right. And did it go down?
What triggered it most of the time is when I'm brushing and I
Right. Spinning.
Yeah,
Uh-huh.
then I felt,
You felt
the tightness there.
Did anything go down the leg or it just stayed there?
So I was playing soccer with my kid and I fell and I had this numbness and tingling to the left side for a while.
Down all the way to the foot?
Down all the way.
How long?
Just
and so,
never felt the same.
how many years ago did that start, you think?
That's about a year ago.
Okay.
Yeah, but now it's mostly resolved, say 90%.
So both of those injuries, when we have the local pain again is the joint, and then we have disc symptoms. So we have the discs starting to bulge out, and that's where we get an MRI, magnetic resonance imaging. X-ray won't show it, and this is where, if you take an X-ray, you might see the spaces looking good because the discs will actually swell before they rupture out. And so a lot of patients sometimes can be led down a wrong path because, your X-ray looks good. It's like, well,
Right.
no, he's 40 years old, your X-ray is actually a swollen disc, and before it ruptures out completely, then maybe 55, the space is all narrowed. But you have to see an MRI to really,
Right, and
to
of
know
course,
what's going on.
Yeah, they did an X-ray
And you're gonna
found
miss
nothing. Yeah.
Well, there you go. Another silly treatment protocol for a young person like this where you have, until you're 60, where then it's obvious the discs dry out and then you have the height loss. But at 40 years old, the discs are going to be swollen, they're more fleshy. And so we want to, if you're going to do any imaging, it should be only MRIs. X-rays would be silly for this. And so we want to, again, do two things. loosen up the areas around. So you'll see me working on the joint below, the joints above. And then at the end of the visit, we're gonna try to see how well we can do about bringing that curve back to your lumbar. Your back should have a sway in it. You understand? When we lose that curve, all the weight goes down to the lower back like a ladder. And then your middle back needs to be soft, right? If your middle back is real stiff, right? See, there's no bending happening where your hand is, right? All the bending is happening at the bottom. And so we have essentially grind this area because this is all stiff. And if I bend with my middle back tight, you're gonna bend too much with your lower back. All right, bend both the knees for me. We're gonna move some stress away from that lower back. I'm gonna help you a little, sit up for me. Take a deep breath in. Try to let all the air out, exhale. Good, deep breath in, I got you, moving. Head back, let it go, I got you, relax your chest. Good, deep breath in, one more. Exhale. Yeah, way too tight right there, okay. I got you. Let's go on your side, all the way on your side, I got you, breathe. Let's see if I can put this, there we go. Breathe for me. I'm not gonna fall, I promise. Take a deep breath. Not gonna fall off the table, I promise. Exhale, wow, really tight. Yeah, it's okay, there you go. There you go. Uh-huh, breathe, exhale. All right, other side for me. It's tight, we'll get it. I don't want you bending too much here. That's why when I'm adjusting you, my hand is up here and down here to try to not let you bend where you've already been bending.
Okay.
Like a piece of paper, if you keep folding it back and forth, it starts to tear. We have to create a new point to bend in. It's like a tooth, you're always chewing on the same areas, and we have to unlock the parts that you're not chewing on. Breathe. I got you, it's okay. Exhale. Breathe. All right, good, very good, okay. Very good. We're on your back for me. A little bit of right atlas, yeah. Okay. B.J. Palmer is the first chiropractor's son, and he spent the last 30 years of his life pretty much talking and writing exclusively about the importance and necessity of this upper neck in functioning to ensure that the lower neck doesn't get destroyed. And the understanding that the curves, the loss of cervical curve is what does it, wasn't completely understood until the 90s. 30, 40 years ago, they started to understand that our lives being inundated with looking down and loss of curve create the environment where the upper neck gets tight, the lower neck gets overstressed, to the point where almost all medical surgery exclusively happens right where you were pointing on that right side on the lower. When you overstress a joint, it will grow. In the same way, if you overwork your muscles, they grow, and if you overwork your skin, you get a callus. The muscles, joints, and skin get larger when we overstress them. When your muscles grow, no one calls it a disease, and no one calls a callus on your skin a disease, but if a joint grows, in America we call that degenerative joint disease. It's not a disease process for a joint to get bigger. It's the same thing as a muscle getting bigger, and if you call a joint getting bigger a disease, you have to call a muscle getting bigger a disease, or calluses on your skin diseases. Do you follow me? They're all adaptations to stress. Here we go. I got you. Doing good. There you go. Just this top guy a little bit. Very nice. There you go. All right? Okay. If you have to cry, go ahead. I'm just teasing. That was amazing. It was the best adjustment ever, Ed. So notice this side was a lot tighter. Do you remember when I adjusted your neck? The right side kind of stuck its tongue at me. The left side was like, okay, sure. This knot right here is at the core of what happened.
Okay, so there's a knot right there?
Yes, sir. Yeah, right here is the problem. It represents a lack of mechanical participation and function. This area is restricted. They found very quickly when a joint doesn't move, it starts to become stiff, and just life and posture injuries, whatever, puts this in an environment where this joint got tight. It can happen as quickly as something like 10 days. Yeah, wow.
Trust me, it's soft.
Fine.
It used to be really, really hard.
I got a strong thumb, but jeez, that is.
I don't even feel what you're doing right now.
Yeah, that is a boulder in there. All right, we'll get it with my elbow.
Like I've pretty much been to
I got you.
hundreds of massage places.
I got you. Oh.
I just don't feel a thing.
There it is. Come on, Nick. All right, I'll come back. Just knuckles. They're designed to bend. I'm not asking them to do something outside of what they're mechanically supposed to be able to do. Right? It's not like I'm asking you to spin your head around. I'm just asking these joints to function in a normal capacity. They're underworking. This joint is way too tight up here. And so for every underworking joint, there has to be an overworking joint that compensates. Wow, he's powerful.
I have a very high pain tolerance.
Perfect. There, a little bit there.
Fall asleep on you.
Go ahead. You can do that. I'm not working hard enough. If you want the core injury, it's right there. That's
I feel it.
Yes, sir.
Are you feeling it for real?
Mhm.
Like, is it deep enough?
I feel it. I feel it. I have literally begged my friends and family to do what you just did, but everybody runs away.
And I ran so far away. Good old flock of seagulls. I just ran. I think it's in the Batman vs. Superman movie when the building's crashing down. You see that movie? And Bruce Wayne is running towards the building that's falling, right? Everybody else is running away, right? And Bruce Wayne is like running towards the building. I'm running towards this knot. Yeah, get it. There we go. It's getting smaller.
Yeah, like it's my gut feeling.
Yeah. It's getting there. You gotta stop feeding it. You're tilting your head left way too much. That's what's feeding it. So if you put your bag or backpack, you gotta stop putting it on your left shoulder. If you put that on your left shoulder, do you see how you hike the shoulder? And that tilts you away from this. So you want to put that actually on your right shoulder, or not have it. You shouldn't have any shoulder. My point is that if you're going to have it on something, it would only be, does that make sense, on your right side, so that it actually would close this side and not tilt your head away from it. Yeah, that's good. There we go. Perfect. Let me see that. Let's see if we can adjust it. Let's try to open this up a little bit. There we go. All right. I got you, bud. Relax your shoulder down. I got you. Now relax your head. I'm waiting. You're fine. There we go. I'm waiting. Let this side go. There it is. Yeah. That bone has not moved in a while. When my butt comes off the chair, I'm working way too hard. Do you see how much higher this is here? How much tighter? From here to here is a huge knot. This is much lower. Nice and soft. This is why it went down the right leg. Do you see? The right. This is why you sprain this side, because this is tight here, and you sprain the right lower. But the reason why you're spraining the right lower is because you have an injury on this left side. And that's probably why you had it down the left leg, and then you're now avoiding the left side, and now we're abusing the right side in what we call compensation. But the oldest injury is right there. My dad has taught me since a teenager to target the stiffest area, right? Because if you can unlock the stiffest area, you give the most relief to the abused area. And your stiffest part, and I hope when you get back home, if people can't see this thing right here, we're in trouble. It is painfully obvious that this is the tightest part of your back, right there.
Yeah, I feel it.
That knot, probably been here since you were a teenager or younger. That's your problem. Okay. All right. I'm gonna get you feeling something here. Yeah, that is way too tight. Right there. It's painfully obvious. They got to be able to find that.
This is new to me.
Yeah, I
So I
understand.
always got the issue with the neck.
Yes, sir. Well, the neck creates this, or at the very least puts this in a position where it's more easily injured. And so, yes, the neck is the ultimate problem, and then it creates domino problems, but that doesn't take away from the fact that this is the most direct cause of your lower back symptom.
Mhm.
Indirectly, yes, the forward head posture, the knot on the right upper part of your neck creates this, but this needs to be untangled. BJ Palmer would have taught just work on this,
Mhm.
and this would go away. And I'm not completely disagreeing with him, but I believe that to expedite this and to get this done in a much faster way, you need to work on this knot. You'll hear it, upper cervical chiropractors, where they're going to be kind of solely focused on the atlas, and I get what they're getting at, but we can't ignore the rest of the spine.
Mhm.
I mean, yeah, wow. Come on. The only thing I can say is don't ask for more, okay? Because I'm just going to give you everything. And if you ask more, I go, that's all I got, but I gave you it all.
I think I feel it easing up though.
Yes, yes.
Oh, good. That's good.
No, I will come back to it, but do you bring it?
So you're feeling this massage, right?
Yeah,
I mean, yeah, a lot smoother over here.
right there.
Mm-hmm.
Is that a knot?
Yeah, these are the roots of your neck, but it's also part of that injury on the left side.
Mhm. Yeah, I feel it. Feels so good.
I think somebody wants you, Carl.
Split there, babe.
Okay. Yeah.
Oh,
Mhm.
never have guessed.
Yeah, nobody showed you that scar right
No, not ever.
there. Everywhere else nice and smooth, smooth. And right there, very big scar. I mean, what a difference. I mean, just you can see it just feel soft here, right? Soft. Lump here on this left side. Yeah, you got to put a back brace on when you're doing any type of lifting of a patient. You got to have a back brace, and you just put it on like a Velcro brace over your lower back to bind up and protect your lower back when you're lifting patients. You can't be doing that without some sort of back support. And then you unvelcro it once you're done lifting. But when you're doing any type of lifting type bending forward and lifting maneuver, it's gonna catch up to you.
Yeah, I did a lot of heavy lifting.
Right. So this is the joint below. This is what I adjusted when you were on your side.
Mm-hmm.
This joint ends up quitting when we sit for too much, and that again puts all the stress on your lower back, lumbar 4 and 5. So keeping this joint in the team, on the team, is imperative. You jackhammer, chiseling away at you.
Feels great.
That cool.
Feels really good.
Did you feel the massage?
Yes, I did. I did.
Just wanted to work this guy a little better. Use gravity to my favor here and work this. Right there, yeah. It's softening up pretty good. Yeah, time to move to Florida. Time to move to Florida. There's no bottle of Dr. Ed I can give you. Yeah, that's the problem. Ed, get out here and work on my shoulder. Work on my neck. Good, nice. Okay. Go ahead and tilt your head left for me. Tilt left. Go.
Ooh,
Go ahead and tilt left.
never had that one before.
All right. Go ahead and tilt right. Up, okay. Okay, tilt to the right. Nothing on that side, okay. And then it's like 20 minutes. Your neck needs to bend over this, so we have to first unlock your spine to make this, possible and to make it effective. What happens is if you put people on this and their neck is stiff, it doesn't do
Doesn't work.
anything.
Okay.
It doesn't work. So this has to be used in conjunction with care.
Okay.
Yeah, your neck, all the bending wants to happen in your lower neck, and I'm asking your upper neck to bend, and it's, really resistant in the upper neck. And 20 minutes, this keeps your upper neck functioning for longer, right? It's like a retainer that an orthodontist gives to keep your teeth from going back to crooked. So with chiropractic care, we use this to restore the curves in your neck and then to maintain them. And then
This has to be done on the floor, yes.
Correct.
Not in bed, right?
in bed, you'd be
Soft,
easier.
squishy.
You could, but it's just less benefit. Ultimately, we need to be able to do this 20 minutes on the floor and it'd be easy.
Okay.
And then to get off, you roll to your side. So roll to your side. There you go, roll all the way to your side. Use your right hand behind you to move it out of the way. If you can push it out of the way, push that out of the way. There you go, and then lay back on your back. That make sense?
Okay.
That's how you get off that. And then after you do that for 20 minutes,
Mhm.
give yourself a few minutes before you get up. Let your body reacclimate, adjust,
Okay.
to show off a little bit.
It feels
Yeah.
decompressed.
Oh, it's gonna change your life.
Yeah.
This
it
is-
does. It really does.
This is my portable thumb. So you asked me, this is called the Deneral pillow.
Mhm.
You can purchase these online. You don't have to be a doctor to buy these. Like this device you can't buy online, but this you can go on the website and buy a Deneral pillow.
Okay.
We need to be on our back sleeping. If we're not sleeping on our back, it's because many times there's monsters in our back that we go to our side to get away from. So my instruction is let's get the spine clean so you don't feel the desire to run away from the problems in our back. This is the Deneral pillow. It has a mini version of the neck guy in the pillow. And then there's a little hole here that you can open up and then head back and let your head sort of sink into that hole, and you can stretch on the pillow. If you want to stretch a little bit, you open up that little flap and then you can stretch, and then if you want to go to sleep and not stretch so deeply, you kind of just lift the flap up, and then it reduces the depth. All right, you doing good?
Yeah, really good.
Nice and
really,
loose.
really good.
All right, thanks for getting here.
Thank you so much.
Awesome, you did great. Awesome, appreciate it, thank you.
Well worth it.